Welcome to our webinar, Chronic Pain in Your Employees, Digital Solutions for a Modern Workforce. I'm Jenna Wessenberg. We have a great presentation for you. Before we get started, I'd like to take care of a few housekeeping items. We will have time for questions at the end of the presentation. If you have any questions, please type them into the questions section at the bottom of your screen. Today, we have Health Check 360's Trent Tungen with us to talk about our exciting new partnership with Fern Health. We're also joined by Dr. Mihir Kamdar from Massachusetts General Hospital and Brad Lawson from Fern Health to share their expertise in musculoskeletal and chronic pain and how Fern Health's evidence-based approach reduces functional pain symptoms. Now I'll turn it over to Trent.
Thank you, Jenna, and thank you everybody for joining us today to learn more about MSK. While I'm talking and presenting, I'm actually going to turn off my video, but we'll come back on throughout the presentation to help answer questions and keep the presentation going. So I'm proud to say that Health Check 360 in partnership with Fern Health can now provide your employees dealing with MSK conditions and the pain associated with those conditions a solution. So I'm very excited for today's conversation for several reasons. We have a lot of great information to cover, but first of all, I've had the pleasure to work with the Fern Health team for several months and learn about their evidence-based approach to treating MSK pain. I'll let the Fern Health team give you an overview of their program, but I want to start by saying they are a leader in this space and they have a holistic approach to treating chronic pain that aligns with Health Check 360's holistic approach to managing health. So not only will you learn about managing MSK pain, you'll also learn how it's associated with depression and anxiety, which we all know has been a very common issue and concern for all employers and employees in recent months and years. Second, we've got Dr. Mihir Kamdar from the Massachusetts General Pain Clinic to help us understand more about pain and why Fern Health approach is better than traditional approaches. So if you're like me, I've always wanted to understand the why and the how. And so why and how does this approach work is something that Mihir will help us to understand. So much more on the science behind managing chronic pain to come. And lastly, hopefully you joined us for a couple presentations in 2021 where we announced that we partnered with MeMD to be able to provide a telehealth solution to support the growing need for mental or brain health services, as well as Equilibrium to help employers build a more resilient workforce. So in addition to these two great programs, we know many of you are seeing the impact that MSK has on your workforce and your medical claims. So we're excited to announce our partnership with Fern Health to round out all the list of services that Health Check 360 can provide you to complete your health and well-being programs. So we've got a really quick agenda here today. Just a quick overview, introduction, but really want to dive into what is musculoskeletal pain and MSK, and then turning it over to the Fern Health team to overview the solutions, and then opening it up to questions and answers. So Jen, if we can go to the next slide. So with that said, we're gonna dive right in. And Brad, I'm gonna turn it over to you here in a minute to share your screen and to provide an overview of this. But before we dive into the overview of the program, there are a few preliminary questions that I think are important to be addressed. First, we've used the acronym MSK about 5 times now. So can you define MSK and elaborate on what conditions we're talking about? Another question that is really important is understanding the prevalence of MSK and what percentage of the population is being treated or self-treating for MSK. So how big of an impact is this? And then lastly, what is that impact of MSK on whether it be financial or quality of life or other for employers and employees who are experiencing conditions, and what is it that's driving those costs? So Brad, that's a lot of information, a lot of questions to answer, but I'm going to go ahead and turn it over to you and let you dive in.
Yeah, thank you very much, Trent and Jenna. We really appreciate this opportunity, and thank you for everyone that's participating today. I think I'd be remiss not to turn this first question over to Dr. Kamdar, though, as the clinical expert. He's going to, I think, define in a much better way than I can what MSK and what musculoskeletal pain is.
Well, thank you, Brad, and thank you, Trent and Jen. It's a pleasure to be here with you all today. And what is MSK is, I think, a fundamental question, because as I think Trent pointed out, you hear the term a lot. And musculoskeletal pain really refers to pain arising from bones or soft tissues. And that can include things like the muscles, ligaments, and joints. And so commonly stated, when we're talking about musculoskeletal pain, we're often talking about what are amongst the most common pain syndromes, which can include low back pain, neck pain, shoulder, hip, and knee pain. Those are kind of big bucket categories for musculoskeletal pain. And a lot of musculoskeletal pain will get better, but as I think, Brad, you'll discuss, a substantial portion of musculoskeletal pain will then shift into chronic pain and have a significant ripple effect on patients and the health system.
Yeah, great, thank you. And I'm going to start sharing my screen here, and we're going to dive right into covering the remainder of these questions and then the Fern overview. So as I think has already been referenced, the interest in musculoskeletal conditions and solution is because they are a significant cost driver for healthcare costs in the United States. The estimates are about $380 billion, which exceeds all of these other conditions. From a prevalence perspective, about half of all Americans are going to experience some musculoskeletal issue every year. This could be, they get up one morning and their back hurts. The story that I tell everyone is my daughter's in college now, but about a decade ago, I took her to an amusement park and thought it would be a smart idea to buy the fast passes so we didn't have to wait in line and for any roller coasters. And instead of riding, 6 roller coasters once or twice, I rode 6 roller coasters 10 times each and couldn't get out of bed the next morning because my low back had seized up. And at the time, it was probably some of the most intense pain I'd felt, and it totally debilitated me. But 3 weeks later, I was totally fine. It was in the rearview mirror. And I generated, 1 doctor visit over it, and so relatively small amount of cost. So the majority of people will experience a musculoskeletal issue, and that can come from an event like mine, or it can come from an injury, doing too much over the weekend, playing a sport, whatever it is. What we're really talking about, though, is that those drive very little healthcare costs. In my case, it was 1 physician visit. He very quickly realized that this was not, a joint issue. It was really a muscular issue. I'd done too many roller coasters, and so did not order imaging, thankfully, and did not prescribe any medications, and just told me to, go home and work on, doing some things that were going to be a little bit uncomfortable, but stretching and movement. But it resolved itself. Where it really becomes a problem is where musculoskeletal progresses. And we're going to talk a little bit about what pain is and why long-term persistent, which is often labeled as chronic pain, becomes a big healthcare driver. And in the musculoskeletal category, about 80% of all musculoskeletal spend is associated with chronic issues, meaning that pain has been persistent for 3 months or more. And the big interventions there are things like injections, other types of procedures, and then surgeries. And we've all probably know someone that's had at least 1 back surgery and maybe multiple back surgeries. And that is really the big healthcare cost driver. Interestingly, a relatively high percentage of emergency room visits are generated by back pain and other type of musculoskeletal pain. And then obviously imaging and prescriptions and other types of treatment. And so this is a very high cost area that impacts employers and workforces, but it's not just in the medical spend. For most employers, musculoskeletal pain is the number 1, 2, or 3 cost driver on the medical plan. It's usually number 2 or number 1 or number 2 on disability, and it's usually number 1 or number 2 in workers' comp claims. And so it has a very broad economic impact. I think what we're going to talk about today is it has also a huge impact on people's quality of life and their ability to bring their best self to work and other aspects of what brings them joy, their families, their friends, their relationships. And that impact has a broad ripple impact, including has been a driver over the last few decades in the opioid crisis that we've had here in this country. So hopefully that answered that question, Trent.
Yes, in great detail, Brad. Nice.
Yeah. So I'm going to turn it over to Dr. Kamdar here to talk a little bit about what pain is and why we here in this country, we actually have a challenge treating pain and chronic pain.
It's a really good point, Brad. And when we look at chronic pain, it is really a public health issue in the United States. And this isn't even just talking about the impact of the opioid epidemic, but one in five people, somewhere around 50 to now probably between 50 to 60 million people in the United States suffers from chronic pain. And as you pointed out, the impact on our health system is that it accounts for more expenditure than cancer, diabetes, and heart disease actually combined, which I think that's a surprise for a lot of folks when we think how the enormity of those different types of health conditions. And I think one of the challenges that we have as it relates to chronic pain is that it takes a very different approach to be able to manage chronic pain well. And what I mean by this, and we'll talk a little bit more about the neuroscience behind this, but when we talk with patients who are dealing with chronic pain, they don't talk about their pain scores, right? They talk about the impact that chronic pain is having on their life, right? So the way that it affects their ability to work. You mentioned disability and the impacts there, but also when people are showing up. We know that it can significantly affect absenteeism. It can affect presenteeism when they are present. And that can then have, consequences that affect their ability to function, to maintain their work, to provide for their family. The secondary effects of that also include impacts on mood. So we know that there's a significant amount of depression and anxiety that can arise in the setting of chronic pain, and chronic pain can also impact sleep. All of that together really affects people's livelihood, their relationships, and their sense of self and well-being. And as we'll talk about, oftentimes in our system, we take sort of a one-sided approach to be able to address chronic pain. What we really need is a much more comprehensive approach to be able to target all those layers in which chronic pain affects a patient's or employee's life. And the challenge on top of that is that most people don't have access to really good pain care. And so, what we oftentimes see in our system is this spin cycle. One of the challenges that we have is that there really aren't enough clinicians to be able to manage chronic pain. So in the US currently, there's somewhere around, probably around 6,000 pain specialists in the United States. When you do the math and think about, the 50 plus million people in the US that are dealing with chronic pain, the math just doesn't add up. And so what that means is most of pain is seen by family practitioners, by primary care clinicians who are incredibly busy, oftentimes overwhelmed. And I can tell you, having gone through internal medicine training, we didn't get much training at all on how to manage chronic pain from a holistic standpoint. So what happens is, these frontline providers are then referring folks to get imaging, which, one of the things we see, particularly musculoskeletal pain, is if I get an MRI on everybody who's 50 years old, half of the people will have, we'll see, degenerative changes or just wear and tear changes in everybody's MRI. Half of the people will have pain and half the people won't. And so imaging alone doesn't give us the answers about someone's pain, even though we'll ascribe those, changes when someone's having pain as musculoskeletal pain. But what can happen is then people get referred for surgeries and injections and other interventions that end up not being the right treatment. It doesn't help their pain, it adds cost, and people continue in that spin cycle. And, for example, here we look at the data related to spinal fusion, which can help a certain subset of patients, but is oftentimes overused and leads to ongoing pain and then subsequent surgeries to try to fix now a new anatomy that's arisen because of the first surgery. And we see that all the time in our pain clinic. So if you click to the next slide, Brad. The other thing that we realize with chronic pain, which is different than acute pain, is that there are changes that happen in the central nervous system that actually sustain and mediate chronic pain. And we also know that our pain centers in the brain, particularly with chronic pain, there are connections to our fear and anxiety centers and also our mood centers. And so that's why we see this connection between chronic pain and anxiety, sometimes to the point where people are afraid to move, something called kinesiophobia, because they have such profound anxiety about their pain. All of that impact can then cause and affect depression. And the other thing that we see is sleep disruption, which we used to think that when people weren't sleeping, it made it harder to cope with the brain. But now we know from functional MRI studies that sleep actually biologically, if people aren't sleeping because of the pain, it actually is an independent factor for people to have worse pain. So there's really a biological connection there. And so we see a lot of this where people have pain, that fear of pain decreases their likelihood for activity. When people then aren't moving, guess what? Their pain gets worse, their mood gets worse, their sleep gets worse. That then causes depression and people are caught in the cycle. And yet we know from studies that if we only focus on the physical and we don't tend to the sleep elements, the mood elements, the anxiety elements, that the physical pain actually won't get better nearly as often and nearly as quickly. And yet I can tell you this, even in Mass General, we're fortunate to have a lot of resources. I don't really have great access for my patients to be able to get the kind of comprehensive pain care where someone is really working on a comprehensive plan that also involves, sleep, mental health support, in addition to the things that we're doing, in our clinic. And that's a challenge. And again, we're pretty lucky with the resources we have, but most of the world isn't like that in the United States. And so what that really speaks to is really having an approach, a real need for an approach to address these gaps that we have in the US healthcare system when it comes to chronic pain, to really address the biological, the psychosocial, and social impacts of chronic pain. That really is the only way to help folks be able to move forward, not only help their physical pain, but help them get back on the wheels of having an effective and meaningful and productive life. And that's where that element of the biopsychosocial approach is really key and really important to be able to do this. Now, just historically, when we look back to the 80s and 90s, before the focus became on opioids and all the lessons we learned from there were in-person multidisciplinary pain programs where people could get referred and they would have a pain plan where you had different members of a multidisciplinary team working with that given patient to come up with a tailored plan of care. And you would have physical therapy, you would have occupational therapy, mental health support, and really come up with a comprehensive holistic pain program. And those programs had terrific outcomes. They really help people be able to not only address their mood, but again, get back into the wheels of life. And the challenges that we had is that, due to managed care and some changes there, these programs had a hard time sustaining themselves financially. And it was hard for people to take the time off of work to go attend these programs in person. But what that means is that we know there's a model that works. It's really about being able to now in the era of digital health, come up with a way to be able to have people have greater access to that and really democratize multidisciplinary, comprehensive, and tailored pain care. So with that, Brad, I'll turn it back to you.
Yeah, thank you very much. I think that is a great overview of what is pain. I think is, when I think about the challenge with pain is that we all experience pain where we think that we're obviously, unfortunately, sometimes I feel like as a part-time older athlete, I'm an expert in experiencing pain. But when we look at the definition of pain, most people are actually very surprised that pain is actually defined as both a physical and emotional response to not only real, but perceived danger and injury. And that's really where this concept of anxiety around movement, fear of pain, kinesiophobia, as Dr. Kamdar referenced earlier, One of the big aha moments that we came to as Fern Health, though, is that while the marketplace and employers were asking for musculoskeletal solutions because of the recognition of the cost driver, we also realized that musculoskeletal pain is not equal to the entire totality of the impact of chronic pain. And so you probably saw in that second slide that Dr. Kamdar showed that while musculoskeletal may be a $380 billion annual impact, with 80% of that being focused on chronic, chronic pain, though, is a much bigger category because it encompasses other conditions. And those conditions are things like neuropathic pain, which is for most people a result of poorly controlled diabetes, fibromyalgia, severe migraine, and then a growing category of people, unfortunately, is cancer survivors. A large percentage, somewhere between 30 and 40% of cancer survivors live with chronic pain, either resulting from the tumor or from the treatments and surgeries that they had. And so chronic pain in totality is much, much larger than just musculoskeletal. And here at Fern, we're focused on delivering this gold standard approach to multidisciplinary, multimodal pain care that Dr. Kamdar discussed across a range of conditions. So we'll talk more about where we are in the development of those, and really focused not just on the biomechanical. Most musculoskeletal solutions are very focused on the biomechanical aspect of chronic pain. Most of them were created by doctors of physical therapy or orthopedic surgeons, but we're focused on this biopsychosocial, so not just the biomechanical components, but the psychological and social components of chronic pain, again, that are highly tailored to the individual and focused not just, as Dr. Kamdar referenced, on pain scores, because I think that was a component of the opioid epidemic, an overly clinical focus on pain scores, but actually physical function. And one of the most important things that we're going to discuss later in the deck or the presentation is that, when we ask people to set goals in the program, only about 10% of the participants in the program set a goal around pain reduction. 90% set goals around getting their life back. And we'll give some very specific examples of that. So I want to talk a little bit about who we are. Fern Health was created through a group of organizations coming together. Grunenthal is an EU-based life sciences company that operates globally, focused primarily on pain. Here in the United States, they have one treatment that is a non-opioid treatment for diabetic neuropathy and shingles, so neuropathic pain. But they are a global expert in chronic pain, and really what they wanted to help create in the initial idea behind Fern was really to impact the opioid crisis, get at the root causes of opioid prescriptions, with recognizing that this access to biopsychosocial approach to comprehensive pain management is relatively scarce here in the United States. Boston Consulting Group, many of you have probably heard about BCG and their digital ventures team. They helped not only create and incubate, but they became a financial investor in Fern. And then finally, Massachusetts General Hospital, where Dr. Kamdar works. They are the largest hospital within the Harvard network, University Harvard. And we work specifically not only with pain clinicians, but with their Center for Innovation in Digital Healthcare. Dr. Kamdar is part of a team of advisors that helped us create Fern, and on an ongoing basis continue to clinically innovate and deliver. But we work with other great clinicians, physiatrists. If you're not familiar with that specialty, it's functional rehabilitative medicine. And then finally, a doctor of physical therapy who has his PhD, named Dr. Adrian Lowe, who is an Iowan, if there's any other Iowans out there, but he is the creator of a piece of content called Pain Neuroscience Education, which we simply like to describe as training your brain for pain. And we heavily incorporate his content and resources into our platform. I want to talk really briefly, I know there's a lot going on in this slide, about what Fern is from a clinical vision perspective. When people enter our program, pain is all encompassing in their life. It is not just physical, it's impacting their ability to work. To give you an example, there have been multiple studies that have demonstrated that chronic pain sufferers work about 20% fewer hours than non-pain sufferers. It impacts their social lives, their ability to perform social roles. That could be a parent, a spouse, a friend. And then, as Dr. Kamdar referenced, a very large impact on mental and emotional health. Most chronic pain sufferers suffer from anxiety and fear about situations where they're going to feel pain. And then, because of all the limitations that chronic pain puts on people's lives, socially, financially, physically, depression is a very high comorbidity. And so that's what people are struggling with when they enter our program. Fern is an evidence-based behavior change program delivered completely through the lens of chronic pain. So, for example, while we work with people on sleep, we're not a sleep program for everyone. Our sleep programming is specifically through the lens of chronic pain. While we focus on movement, we're not a fitness program for people that are already, trying to get more fit. It is a program delivered through the lens of chronic pain. And really what we're trying to help people do is help them both physically and emotionally reconceptualize their pain as a sensory output of the brain. That's another thing that you learn as you get really focused on pain, is that pain only exists in our brain. That does not mean that we make it up, but that is where pain resides. And we really want to move people to this place where pain is not dominating any domain of their well-being, and that they get to a point of self-efficacy around the habits and behaviors that they can do on a daily basis to not have pain dominate any aspect of their well-being. And that is really the goal of Fern. So how do we do this? So we have a digital platform, as we've discussed, and this schematic gives a high-level overview. Across the top, we call these our health pillar behaviors that we're focused on. So there's 5 pillars in our program. Most people immediately think of exercise therapy there on the left. And exercise therapy, virtual exercise therapy, is that component that is really trying to digitize and democratize the access to good, high quality physical therapy. But in any of these programs, whether you're going to PT in person or you're doing it through a program like ours, the average person is going to do this intentional prescribed exercises around the joint or area of their body that's in pain, 2 to 3 times a week for 20 to 30 minutes at a time. So let's just call that 80 minutes a week that they're going to be doing these exercises. But if you do the math on how many minutes a week there's 10,080 minutes in every week. And so those other 10,000 minutes mean way more to their progress in pain management. And so these other 4 health pillars are so critical to Fern Health helping individuals reduce the impact that pain is having on their life. And so, we differentiate daily movement, meaning just getting people to move more on a daily basis, as different from intentional exercise that they may do 2 to 3 times a week. So we have built a movement program, a daily movement program that was based on a NIH study for people living in chronic pain. It can be described as a start low and go slow. So we're really trying to understand how much someone moves a day in both minutes and steps. And then through the program, slowly increment them up. They may never reach that, mythical standard of 10,000 steps a day, but many people that are entering our program are doing 15 to 20% of that. They're really sedentary. They've got fear of that intentional movement. And so that's the goal. Dr. Kamdar already talked about sleep, and sleep is a critical component. In fact, about 25 to 30% of people that enter our program, when we ask them their why, what are you trying to achieve? A very common goal is, I want to be able to get 4 to 5 hours a night of sleep uninterrupted by my pain. And so you can understand the impact that would have on somebody's quality of life. We've already talked about the emotional health component. And so we have emotional health programming that's focused on, not overall and generalized anxiety and depression, but the anxiety and depression that is resultant in contributing to chronic pain. And then finally, nutrition. There was actually just a study that came out a week or so ago that was published that was exploring just the role that nutrition has in chronic pain, and that it's tied into the pleasure and pain centers in our brain that Dr. Kamdar spoke about. And so nutrition, the role that nutrition can play for pain patients is really important. For things like musculoskeletal, we want to educate people about the role that inflammation plays in pain and in joint health. But for other conditions we're building, such as migraine and fibromyalgia, nutritional considerations can be a trigger for those types of conditions, for outbreaks or for events. And so we're trying to educate the individual about that. So those are the pillars or the health behaviors that we focus on. The middle layer is the tools we use. So as referenced earlier, we incorporate Dr. Lowe's pain neuroscience education. These are educational pieces about what pain is and why we heard and the role that pain plays in our central nervous system, and how when that alarm system, because that's really what pain is. If one of the stories is if you stepped on a nail, would you want to know about it? Yes, you would, because you might get infected and it's going to continue to do tissue damage. Well, pain is that alarm system, but with chronic pain, that alarm system is continuously going off. There was actually a really interesting article published at the end of last year in Outside Magazine that talked about the disconnection between injury and pain. When we get injured, we expect to have pain, but if we have pain, does that mean we're injured? And the study and the data and the science is saying that no, not all the time. Those two things are not actually connected. We can be in pain without underlying injury, and this really gets to that psychosocial component. Mindfulness and meditation. Actually, the first applications of mindfulness were focused on chronic pain and helping people to manage chronic pain. And in fact, Dr. Oz, his show over the holiday break just recently did a whole session on managing chronic pain just from a mindfulness meditation and psychological component or approach, and without using any physical interventions. And it was based on a study that was done that showed that that actually has better outcomes than just putting people through physical therapy. And so we incorporate a significant amount of that type of programming for people that are willing to try it. Some people have never been introduced to it, and they're not interested, but a lot of people, especially pain patients, are looking for innovative ways to manage the pain. And so we make those resources available. We incorporate wearable devices, whatever device an individual has, because we want to have a way of understanding on a daily basis. Are they starting to sleep better? Are they moving more? And then finally, digital by itself rarely works. So Fern employs pain management trained health coaches that are there to help guide, mentor, and facilitate the program for our participants, what we call members. And across the bottom, these are the conditions that we're focused on. We started in musculoskeletal. It was the first module that we launched in the 5 body parts that Dr. Kamdar referenced earlier: back, neck, shoulder, hip, and knee. But we are just in the next quarter going to be launching our next 2 modules, which we have built in conjunction with Massachusetts General Hospital's pain specialist, Dr. Kamdar, and some of his peers. And those are migraine and fibromyalgia. And then in further development, we are working on neuropathic pain and long-term cancer survivorship that will be coming at the end of this year. And so one of the things we wanted to cover was just the user journey. So when somebody becomes a Fern member, they're going to download our app. They're going to create a pain profile. We use a clinically validated pain measurement tool called PROMIS. It's used there at Harvard. It's used at most of the multidisciplinary pain management clinics in the United States. And it's looking not just at pain scores, but physical function, sleep health, the impact that it has on somebody's social roles and depression and anxiety. And from that, plus interactions with the health coach, their goal that they set, and then data that comes into the platform continuously, we create this guided, tailored experience that's supported by their health coach. We don't want to project that physical therapy and therapeutic exercise is not important. It's critically important. What we find, though, is a lot of people, when they come into our program, are not ready for that yet because of that anxiety and that fear. But when they're ready, We have therapeutic exercises that are self-guided, they're safe. Individuals can rate and decide, that I don't like that one. We'll project or recommend a substitute. They give us feedback after every session, and we modulate up and down based on how they're doing. In fact, last summer, we published a study at the American Telemedicine Association conference about the outcomes of using this approach and the feedback that members give us to effectively deliver a program that's safe and effective. As we also said, there's weekly brain training. This pain neuroscience education, and that's combined with sleep training, nutritional training that is only delivered to members that actually need it. So if you're not struggling with sleep health, then we obviously can give you some basic sleep education, but we're not going to put you through our sleep module. Again, the health coach is so critical in this experience with our members. All of our health coaches are certified wellness and health coaches, as well as they've gone through additional pain-specific coaching training. They're there to help set collaborative goals, facilitate and motivate, and they're really trained in the shared decision-making process of helping people understand what is the right care path for them and understanding the trade-offs of some of those in relation to what's important to them, the goals that they've set. As I referenced earlier, we're very focused on not only effectiveness, but safety. We're able to rate each individual exercise that an individual has, give us feedback. And if there is any type of triggered event, which means somebody said they experience a lot of pain, one of our doctors of physical therapy is alerted, and there's an outreach that takes place and an interaction to make sure that everything that our members are doing is not only effective, but safe for them. Again, the connected device is so important. It gives us daily input about how they're doing. Are they progressing on their care plan in a really low friction way for the member? Whatever device they have, they can link into the Fern app through the platform. And for some clients, we actually can distribute a device. Our preference is a simple Garmin device that's low cost. It in a good way measures movement and sleep, and it has a year-long battery life so that people aren't constantly having to take it off to charge. But again, if they have an Apple device, if they have a Fitbit, if they have an Android-based like Samsung device, they can bring that to the program also. So the integration with HealthCheck 360 is actually really critical. Fern will be integrated into the benefits wallet within HealthCheck 360 for clients that have licensed it. And there will be a seamless integrated experience for the member. We want to make this extremely low friction, recognizing that we don't want to encourage member confusion. So the experience will be cohesive and low friction for participants. Just kind of in summary, I wanted to just, be able to kind of sum up what our approach is. And again, it's this biopsychosocial approach. This approach has been around, as Dr. Kamdar referenced, since the 70s. It was extremely available in the United States up until the mid 90s. In fact, at one point in the early 90s, there were about 1,000 of those true multidisciplinary pain management clinics in the United States. But because of really two factors, the opioid crisis and then the introduction of managed care, they became financially unviable for many of them. And the last count that we were able to see, or the last census, was done in 2008, and there were only 83 of these clinics left. And they tended to be in places like Harvard that, pretty inaccessible to most Americans. And that's really what we're trying to solve for, is to deliver this true evidence-based biopsychosocial approach rooted in pain neuroscience education, recognizing that sleep and daily movement are just as important as physical therapy, supported by a real health coach. We wanted to bring it all together into a real person. So I'm going to talk about a real member, obviously not giving her name or any identifying data, but about a year ago, this member entered our program, and it really touched my heart, because I was just having a daughter go through this exact same experience of trying to decide where to go to college. And so we were doing college visits. My wife and I, we were walking college campuses with her to just help decide where she wanted to go to school. And we had this mother that set what we call a social role goal. And the goal was that her daughter was about to start this process of deciding where she was going to go to college. And the mother wanted to be able to participate. The mother wanted to be able to go on these college visits and walk the college campuses with her daughter. And she couldn't do it. And so our job, and it was through both the promise assessment up front and through the coaching interactions, be able to understand, well, what are her barriers? And we really figured out that she had 3 barriers. She had anxiety about movement and being in pain. So she, this idea of going to these college campuses and maybe having to walk for hours a day, miles across these massive campuses. For example, my daughter picked Ohio State, huge campus, lots of walking, really, really made her nervous. Second, she wasn't in very good shape because of that anxiety and the limitations that her pain had put on her. She was living a pretty sedentary lifestyle. So she needed to kind of get physically ready to move that much. And then finally, she wasn't sleeping well. She had a lot of fatigue and low energy because of the pain that she had at night and waking her up all the time. And so the Fern Care Plan was really focused on those 3 things because that's what was important to her. We didn't try to put her into PT right away. We knew that she had kinesiophobia. So we're really focused on how do we get this mother to understand what pain is and how the psychological components and why her anxiety is there and what she can do about that. So we put her through our emotional health programming. We obviously wanted to focus on her sleep. So what are the things that she could do that could help improve her sleep, and how moving more every day was actually going to help her sleep better. And then finally, moving more to build up that physical stamina to be able to go and do these events with her daughter. And again, that was supported with pain neuroscience education, mindfulness and meditation resources, and our health coaching. And so this shows you that, a real woman, a real mother, a real employee, how this all came together and helping her meet her quality of life goal. This was really, really important to her, and being able to bring her, her best self to not only her family, but we're sure that this impacted her ability to bring her best self to work also. And so quickly, I just want to talk about what we measure in the program and what we're able to achieve. The Fern Health program is an 8 to 12 week program for most members. We're actually, for some of these other conditions like fibromyalgia and migraines, they'll be a little bit longer, but we support the person well after that active 8 to 12 week program. We're really trying to balance the amount of time it takes people to get to self-efficacy around these health behaviors without fatiguing them, of having intervention fatigue, which is a real thing in healthcare. So what the CDC defines as statistically valid results is about a 30% reduction in pain. That's what the CDC defines as clinically significant. And so as you can see, about 60% of participants have a clinically significant reduction in their pain intensity. The average pain intensity reduction is 40%, which is really, really high. About a 38% improvement in physical function, which again, that really gets down to quality of life. About 61% of people just feel better. Feeling better is a major outcome for people living in chronic pain. And we tend to see about a 40 and 41% reduction respectively of those people that have depression and anxiety as they enter the program into depression and anxiety. One of the big outcomes, especially for musculoskeletal, that people, that our employer clients are looking for us to measure is, does this impact their utilization of healthcare? So we are asking them at the beginning of the program, lots of questions about the healthcare they're using today related to their chronic pain. So physician visits, specialty visits, medications, injections, things of that nature, and where they fall in that decision-making process around the intent to have surgery. We see an average 67% reduction in the of members' intent to have surgery from the time they entered the program till the time that they enter it, or that they exit it. Our estimates from all of these calculations is that the ROI is about 4 to 1 based on the reduction in healthcare utilization. We're not factoring in other quality of life metrics like presenteeism and so forth. This is really just coming from those reduction in healthcare utilization specific to their pain. And then finally, 97% of people would recommend Fern to a peer or a friend, which is just a really important metric for us in making sure that the people that use Fern see it as highly valuable and they would recommend it to a third party. So that's the end of my slides, Trent and Jenna. And I know we have some questions that we want to answer from our participants. Thank you.
Nice job, Brad. And Jenna, while you're pulling up the next slide, there is one last piece I just wanted to mention. At the beginning of the presentation, I mentioned that the Fern holistic approach to managing chronic pain, the reason, or that they have a holistic approach in similar to HealthCheck 360's holistic approach to managing overall health and wellness. And so you might be thinking, well, HealthCheck 360 has health coaches and we have nutrition information and sleep, and we have solutions for mental health, depression, and anxiety. The key difference here, though, is that everything on the Fern side is done through the lens of managing pain. So their health coaches are certified in pain management and coaching there. And so the goals that they set are specific to pain. And while, if you're somebody who has experienced pain, you're maybe more likely to understand that how the approach has to be different. That if somebody is experiencing chronic pain, that it's, Brad, I think you used the term start low, go slow. While HealthCheck 360 always says, progress over perfection and taking baby steps, and that is key, it's even a step further than that when you have somebody with chronic pain and helping them to get started. So I did want to distinguish a little bit more between the HealthCheck 360 programming and Fern Health programming. I think that's an important piece.
Yeah, thank you very much. Yeah.
Okay, perfect. I just want to remind everyone, if you do have questions for this team, feel free to type those in the question panel in the lower portion of your screen, and we'll get those answered for you. So kicking off here, one of our first questions is, how does your program enrollment and pricing compare to maybe some other vendors in this space? Do you bill on a per enrolled basis?
We do. So we do enroll in or bill on a per enrolled basis. Our pricing is about, I think, half of some of the other vendors that we've seen in the space. We're at $450 per enrolled participant, with some performance guarantees that are included there that are really tied to our ability to deliver real results for our clients.
And Brad, with that, if we had an employer group, what percentage of a population do you think would be enrolled, or that would?
It's a great question. So as we referenced earlier in the presentation, about half of all Americans are going to have a musculoskeletal event in a year, but the vast majority of those are kind of what I described as, which is I pulled my back, did too much, a couple of weeks, and went by. Programs like ours, really, I would argue any type of these intense interventions are not appropriate for that. The vast majority of musculoskeletal issues resolve on their own. We call that regression to the mean in the wellness industry. What we're really focused on is what's called subacute and chronic pain. And so what subacute pain means is it's not, the injury didn't just happen. And usually from a categorization perspective, acute pain is defined as I've been in pain for a month or less. Subacute is this intermediate period, which is it's been more than a month, but it hasn't been 3 months. So this is that period of time where the injury is already starting to heal or healing, yet the pain is still there. And so that type of pain is what we call subacute. And we definitely want those types of people to become participants in Fern. They have not, though, often developed the comorbidities of depression and anxiety and sleep problems. So their intervention may be much more focused on that physical rehabilitative exercise. And then chronic pain is actually, as we said earlier, about 1 in 5 adults in America, meaning 20%. But that's encompassing of all those conditions we talked about at the bottom of our platform slide. So fibromyalgia, neuropathic pain. But chronic musculoskeletal makes up half or a little bit more of that. It's the most prevalent form of chronic pain, and back pain is by far the most prevalent of all of those. And so a good way to think of this is that, you know, you've got about 20% of the population that's living with chronic pain, and then you have another 10 or so that are in that at any given point in time are in that subacute perspective, which is, you know, they're well past the injury, but they're still in pain, but they haven't developed these comorbidities yet. And that's really the population that is eligible that we want to focus on, because, you know, we obviously want to get involved in prevention of developing chronic pain in that subacute group. But they don't need as much. They need much more heavily on the pain neuroscience education and the physical therapy and movement. And then we want to make sure that they don't develop those other comorbidities that we talked about.
Okay, great. Thanks, Brad. We have some other questions coming in here. A question on how does your program gather imaging if a member does not have current tests available?
Yeah, so we actually don't today gather imaging. And in fact, you know, I think this has been one of those places that the orthopedic focus on chronic pain has really focused on this physical, you know, check. Study after study, and Dr. Kamdar referenced this earlier, that if we take a group of people that are not living with chronic pain, have no back pain, and we give them imaging, the actual statistic in the last study was 68% of those adults would have something show up in their MRI that if they were living with chronic pain, the physician would try to link those two as causal. And so what we're really focused on is the lifestyle and behavior issues that range from therapeutic exercise, like strengthening and stretching and so forth, through daily movement with all the ones in the middle, getting people to self-efficacy around those. And so imaging, while it is appropriate for some types of patients, it actually has been massively overused in our country because of the lack of access to good comprehensive chronic pain treatment. If you go in most places in America and there's something that's labeled as a pain clinic, it's actually an orthopedic spine clinic.
Yeah, and I'll just add to that from a clinical standpoint. I agree with you 1,000%, Brad. You know, imaging, there's usually when you look at kind of the evidence, there's a very narrow indications for, let's say, imaging of the spine. And yet, you know, the cost that we see in overutilization of MRIs just from getting that test, which is not a cheap test, plus then when you look at the findings that you get, and to your point, that oftentimes aren't correlated with pain, but then lead to more interventions, is a real problem. And the truth is, oftentimes when we look at, even when we get those studies, the actionable elements are often still the things that we're talking about. It's you know, movement, physical therapy, the mind-body elements. Let's work on sleep. And so I think in many ways it is more evidence-based with this. It doesn't replace the care of a physician. Folks can still obviously see their clinician, but it's more evidence-based. It gets people the kind of therapies that are indicated, and then can prevent things that aren't needed oftentimes, like costly imaging that can then have, you know, some oftentimes non-benign consequences when people go then down the algorithms thereafter. So,
yeah, you know, I believe this to be true. So I'll say it with confidence that we're the only company in the space that was created from the ground up in conjunction with one of these very rare multidisciplinary pain management clinics. The rest of the companies in this space were created through the lens of orthopedic surgeons and doctors of physical therapy. And while Dr. Kamdar referenced that, you know, doctors of physical therapy critically important to be part of the care plan, they're not the center of the care plan in a multidisciplinary pain management clinic. A pain physician is. And so that's really the lens that we've created with Harvard and MGH. And that multidisciplinary approach can be extended across other pain syndromes like fibromyalgia, severe migraine, which have a significant impact from a prevalence and cost perspective on employers also.
Okay, thank you guys. On to the next question. So on the self-enrollment of members, do you look at an employer's MSK claims pre and post participation?
We have. So we've had clients that have wanted to share with us the impact that musculoskeletal and pain management is having. it's very broad. We're looking at things like avoidable ER visits because of musculoskeletal issues. We're looking at procedures. Nobody goes to have back surgery because of a recent injury unless it's a severe trauma, right? People that have back pain, they've had it for years before they get to the point where they're willing to consider a pretty invasive and risky procedure, right? And so those are the big outcomes. The other thing that we're really focused on with our employers, and where you will see, another what we call pillar in our program by the end of this year, is the medication side. Today, we are not actively trying to intervene around individuals that are using opioids. We do assess it. We obviously collect that information, but we're in development with MGH on, what do we do actively when somebody has been prescribed opioids by their physician and maybe is at risk of opioid overuse or misuse, and helping to titrate them and level them down. And using these other methodologies, I think we all recognize the real risks of longer term opioid use. So when we look at our clients and their claims, the impact of pain is pretty broad. It by far, when they think about it in that context, is the number one cost driver when they start looking at not just the intervention or the procedure based, but the number of visits, the avoidable ER visits, and then the medication side. It almost always, when you look at all of that, added up. Now, some of those opioid prescriptions are valid. It could be after a surgery or something like that, but we all know that they've historically been overprescribed for things like back pain and knee pain and so forth also. So yes, we would look at
Brad,
the client pre and post.
Brad, I was going to ask, just to expand a little bit further, you mentioned a weekend warrior incident where, resulted in back pain. I had one too. So let's say that you have a weekend warrior that, they go and they do whatever. Last couple of weekends ago, I was out skiing with my daughter. We fell, my knee hurts for a couple of weeks. I was limping around. But let's say you get that person that comes in and they're trying to opt into the Fern Health program. How does that go for them? How does that conversation go to say, you're not appropriate for this? And then how does the billing work?
Yeah, so if an individual, let's just take you, for example, you hurt your knee 2 weeks ago and you tried to enter the Fern program, we would say at that point, hey, Trent, you really should be working with your physician to make sure there's not some structural damage there. You didn't tear your ACL or something like that, right? And so that's important. So if it's been less than a month, we're really going to focus the individual and say, let's get you back to your physician. We can then reach out to them, several weeks later to say, are you still experiencing pain? Are you in that subacute category? And then we're going to make sure that, okay, your physician cleared you for something like rehabilitative therapeutic exercise. And if you're interested in entering then we would take you in. And again, we're going to be focused on, I would imagine the impact that you've had, Trent, is you're probably moving less, right? So let's get you moving a little bit more. Are you ready to start doing some exercises specific to where you hurt yourself? So our therapeutic exercise part of our program would design an intervention for you there. And then we're going to try to assess things like, do you have some sleep problems? And let's educate you about, the connection between your anxiety and fear and pain to make sure that you don't develop that going forward. And so again, the program is highly tailored. Pain, I want to tell people though, that one of the really, people always say, well, if pain is such a big deal in America, why haven't we focused on it as much? Well, the actual pain as a discipline in medicine, shockingly, is only like 50 years old. Even though when Mihir first told me that, I said, well, isn't that the very first thing that early humans tried to, medicine was somebody was hurt. But as a discipline itself, anesthesiology is a little bit different than pain management. So pain management is relatively new. And so, we haven't had the focus in the resources, but, we do now, and that's really what we're trying to digitize and democratize here in the US.
Yeah.
I will add one thing and a little bit of a shout out, but this is starting to get national attention, the chronic pain issue. There's actually a White House event next week around health equality that Massachusetts General Hospital is going to be speaking at. And Fern Health is going to be profiled in that meeting at the White House to talk about the lack of access to good quality pain care and how specifically telehealth and digital health can help solve for that. So we're really excited about that opportunity and the exposure that this topic is getting at the national level by the administration, and specifically also that Massachusetts General Hospital and Fern are getting highlighted in that work. So.
Great, that's super exciting, Brad. Thank you so much for all of that information. Does anyone have any closing thoughts for the group? I know we're at time, so if there are any final things that you want to share with the audience.
We have gratitude. Thank you.
I would just add in that if you're ready to have that conversation, please reach out to the HealthTech 360 sales rep or to HealthTech 360 in general, and we're happy to help you start that conversation and provide you more information and provide a quote and the process to get the ball rolling to help your employees.
Yeah, thank you very much. We appreciate the time of everyone that joined.
Thank you. And I do want to mention that I know that there were some questions still remaining. So we will follow up with you individually to make sure that you do get those questions answered, since we didn't have time in this session today. That does conclude our presentation. I want to thank Dr. Mihir Kamdar and Brad Lawson for joining us today. That was some fantastic information shared, super informative. All attendees will receive a follow-up email with links to the presentation recording and contact information. We hope you're all walking away with a little bit more information on how chronic pain can affect your employees and how the right approach can help them. Be sure to subscribe to our blog and follow us on social media for the latest on HealthCheck 360. Stay healthy.
Thank you.
Thank you.